American community with innovative and trustworthy initiatives and programming like this radio show. To find out more about Community Hero Action Group, be sure to visit communityheropa.org. If you have a show idea, be sure to email us at contactus@communityheropa.org. Overcoming domestic violence. Now, we need to get the lasting impact of domestic violence and explore the vital need for legislative change in this regard. So I want to choose to gain or maintain power and control over an intimate partner. Now, this abuse can be physical, sexual, emotional, economic, or psychological actions or threats of actions that influence another person. Domestic abuse can happen to anyone. No matter your race, your age, your religion, your people from literally all walks of life. Now, this show is meant to educate and inform, but if you need immediate help or resources for your hotline, at 800-799-7233. Again, that's 800-799-7233. Or you can go to their website at thehotline.org. They have a 24/7 chat line. If you believe that today's topic might be too much for you to handle emotionally or be too triggering, or if you have little ones in the area, please take the necessary steps you need before we begin today's program. And as we begin today's discussion, I want to invite you to give us a call and let us know if you or someone you know has been affected by domestic violence. If so, what steps did you or they take to seek help and support? Your experience could help others. You can join the show by calling us at 215-634-8065 or toll free at 1-866-361-0900. So let's start today's Speak On It segment. And as we begin our discussion about domestic violence, we have two guests, Debbie Bookman and Ashley Thompson. Debbie Bookman is a domestic violence survivor. She's an experienced organizational director with a demonstrated history of working in the public industry and community organizations, and also serves as the, now I don't know how to pronounce this, Protho Notary of Chester County. Welcome, Debbie.
Thank you so much.
We also have Ashley Thompson. She's the Director of Counseling Services at Laurel House, which is a comprehensive domestic violence agency serving individuals, families, and communities throughout Montgomery County, Pennsylvania. Welcome, Ashley.
Thank you so much. Thanks for having me here.
So, Debbie, would you please share with our listeners a little bit about yourself and some of your personal experience as it pertains to domestic violence?
Sure. Thank you so much. So I am Chester County Prothonotary, and I went to that office. That office is the chief clerk for the civil filings in the Court of Common Pleas. And one filing that you can make in that court office is a protection from abuse order. And I went there in 2008 seeking a protection from abuse order. And I asked the staff, where do I put my name? Am I a plaintiff or am I a defendant?
Mm.
And they told me they couldn't give me legal advice. And that is where I realized that when the opportunity came up for me to run for this position, that I could make it a more user-friendly office for other Debbie Bookmans. I moved to Pennsylvania in 2005 with my two daughters. I was leaving a bad relationship. At the time, I didn't call it a domestic relationship because I didn't think that I was in a domestic relationship. I thought we were fighting and that was it. Um, and I came here in 2008. In 2005 and 2008, I went to seek protection from abuse order in the hopes that that piece of paper would protect me and my children. And as a result, we were stabbed. My daughter, my oldest daughter, and I were stabbed multiple times by my ex. And it was like an out of body experience. I didn't want to talk about it. I had a mantra in my house: what happens in our house stays in our house. I was embarrassed.
Wow.
I didn't protect my kids. I didn't want people to know that I had failed in my mind as a mom. And at the time, as a partner, I felt like, what did I do wrong? I was constantly putting it back on me, trying to figure out what did I do. Today, in 2023, I realized it wasn't me.
Mhm.
And I realized that I am such a strong
That your daughter is here to even share your story. And you gave a little bit of a hint about how that experience impacted your well-being or your how you saw yourself. Do you want to dive a little bit more into how that experience, just being in an abusive relationship and having that um, particular trauma of having been stabbed and having your daughter stabbed, how that affected your emotional and perhaps even physical health?
absolutely. Um, I during the relationship, and I realized that it started even earlier with my dad, being told that I was worthless, that I would never amount to anything. And then I get into a relationship now, seeing was almost identical to my dad. And I felt, or he made me feel, that I was fat, ugly, nobody would want me. This was as good as it was going to get. And I always saw myself as a strong person. And that going through this experience and feeling the way that he made me feel, that I allowed him to make me feel,
Mhm.
made me realize how strong these psychological games that people play on you can be. The gaslighting, I pride myself as a strong Black woman, but he broke me down in that moment. And I didn't know how to put the pieces back together. And there were times when I felt, you know what? Maybe my kids would be better off if I wasn't here. They would have a better person to take care of them.
Mm.
And I realized, nope, they're mine. No one can do better by them than me. I just looked at it. I made a really poor judgment call, and I'm going to get myself together. And I did. But it really helps me understand, or you are, once you're out of it, if you survive to talk
Yeah.
about it, it'll make you feel like, how did I get there? Who was that person? And what can I do to never be become that person again.
Well, it's interesting. While you were retelling your history, at one point I kind of lost track of whether you were talking about your father or your partner, because sometimes we have these things that really carry with us. There are elements of it that may be slightly different, but because that the abuse can be on different levels. Your father may have never, struck you, or I don't know what's the correct past tense of strike you, but he may have never done that. But there was an element of that was abusive, and weaving into how you may have found yourself in that relationship. So that, I think, is really a key point for other people to reflect on as you share your story. I want to bring Ashley into the conversation for a second. If you wouldn't mind jumping in here and explain the role of organizations like Laurel House in supporting domestic violence survivors in their journey to recovery and healing.
Sure, yeah. First of all, I just want to say hello to Miss Bookman and thank you so much for sharing your story with us and everyone who's listening. I really, appreciate you using the space to do that. So Laurel House is a comprehensive domestic violence agency. So throughout Pennsylvania and a good number of states in the United States, there are domestic violence agencies within each county almost. In Pennsylvania, in some of the more rural areas, there might be 2 counties that share a domestic violence agency program, but for the most part, each county has about one. Montgomery County, where I work out of, has 2, the Women's Center and then also Laurel House, where I work. And we're a comprehensive agency, which means that we provide just a myriad of services, regardless of whether a person is wherever they're at in the process. So they could be actively in an abusive relationship, they could be planning to leave or just left, or they could be out for several years. Regardless of where they are in the process, we're here to support them. So that can be through the court process, similar to what you were discussing, Ms. Bookman, about the PFA office. We have advocates who help with that through our domestic abuse response team. We have a safe haven shelter. We help with transitional and rapid rehousing. We have our clinical counseling program. We have a legal advocacy program, a medical advocacy program to train medical professionals about domestic abuse. And then we have community education, which kind of falls under something like this, or going out and doing trainings. Pretty much anybody who will listen to us will go and talk with them about domestic abuse and our services and how people can seek help. So we really see ourselves as being there at whatever point a survivor seeks out the
Be anywhere. Is there a way for someone to identify with a central resource where they're county, for instance?
Yeah, absolutely. So there's a couple of things that you can do. You can go to the Pennsylvania Coalition Against Domestic Violence. It's pcadv.org. That's the Pennsylvania, I would call it a parent agency or the umbrella agency that oversees.
In terms of Ashley, from a service provider, and Ms. Bookman in terms of being a survivor, you talked about an experience in the aftermath of your traumatic experience? Did you suffer from PTSD? If so, how did you manage it?
So it's interesting the things that triggers my PTSD. Again, not identifying with it until recently. Um, my ex came into my home and took one of my steak knives and stabbed me multiple times and cut my daughter across her throat, not too far from her jugular. I don't own a set of knives. I do own a few knives. I am always, and I'm learning how to control my how I think about it, because someone will do something, they're not intentionally doing it because they know, but
Mhm.
I know. So I try to, it's almost like I have these little voices telling me, Debbie, I talk to myself. They're not being intentional. They don't know, you know. So when it comes up, that's what I do. Um, it impacts how I deal with people in general. I tend to think negative. I tend to think that people are only being nice to me, or they're only doing something because of some, there's a ulterior motive for
Mhm.
what they're doing. Um, it's a lot better than it was, but it's something that I think will always stay with me. And it's a plus, but it can be it's a negative, because I think that it will forever impact any relationship that I have moving forward. Um,
Have you found that there were certain things that did help you through that? Have you been in counseling before? Did you find it helpful? Um, Anything that has helped?
my dad was a minister. I grew up in the church. And when all of this happened, I would say about a year, maybe after, I kind of woke up one day. I was 38 years old, I never forget. And I said, you have to get your stuff together. And I started reading my Bible again. And I read this book by Ayan Levanzat, In the Meantime. That book changed my life.
Wow.
It helped me begin my road to recovery. And I keep a copy of it in my desk drawer at work, at my house, and I reference it when I talk to other people that are going through things. Um, and yeah, prayer, and my children, and now my grandchildren. My daughter that was stabbed, she is now a mental health therapist helping children with trauma. My youngest, who witnessed it at age of 5, she struggles, but she expresses herself through her art
Mhm.
and photography. And I think I never got any formal therapy, but I worked for an organization that dealt with mental health, child guidance resource centers. And talking to the therapists there, I was telling them what to do with their clients, but it was really, this is what you need to do, Debbie. And so that helped me. But every day, I'm surviving. It's hard. I think about it every day. Um, and it's hard, but I get through it.
Well, thank you for sharing that, and sharing even that resource, the book that was like a turning point, or kind of triggered a turning point for you. Would you say, Ms. Thompson, that her experience, what she described, is a pretty characteristic story that you hear in terms of the survivors that you work with?
Can unmute myself. Sorry about that. So I think um, every situation that we hear is different. Everybody's experience is their own. And also, yes, a lot of what Ms. Bookman shared are things that I have also heard in working with individuals, specifically around the PTSD symptoms and things that maybe you didn't think of
Mhm.
being what activates you or what causes that increased distress in you. Um, could be a smell, it could be a food, it could be a color, it could be the sight of something. And all of a sudden you're back in that moment where you feel immediately threatened. And so then your brain takes over to protect. And, your what you described, Miss Bookman, are, grounding skills and to ground you back into the moment so that you're able to emotionally regulate and move forward and not allow it to continue to impact you, which is amazing. It takes a lot of time and practice to be able to get those in place and to work through those triggers as they happen. Because as you said, people don't actually really know when they're causing that with another person, right? But when it's your own experience. And so it's hard to do, but that's something we spend a lot of time with individuals on, is working through different grounding techniques and ways to help them emotionally regulate after they've had abusive incidences.
Right. Well, again, for our audience, you're listening live to the Her Health Matters radio show, and we are talking about domestic violence. We are live at 900 AM, 96.1 FM, and streaming on Facebook at communityheropa.org. You are welcome to join the discussion by calling 215-634-8065 or toll free 1-866-361-0900. You can also leave your responses on the Facebook page at Community Hero PA. If you or someone you know has been affected by domestic violence, we want to hear from you. What steps did you or they take to get help? Help out your fellow sisters and brothers. Your shared experience, just like Ms. Bookman's experience, could give someone the strength they need to take the first step. Now, Ms. Thompson, one of the points that came up as we were preparing for today's show, you mentioned to our show's producer about continuity of services and continuity of care, and how this sometimes can cause a delay in someone, recognizing their situation. Can you expound on that and just explain how that might play out?
Sure. Yeah, I think in particular with that discussion, we were talking about continuity of care in the healthcare field. So whether it's mental health or a physical health care facility, recognizing that if you're practicing in a medical profession, you are going to be interacting with individuals who've experienced domestic abuse, either as children and their families or now as adults. The statistics are there, and they tell us that is true. 1 in 4 women, 1 in 7 men, and those are based on what we know. There's a lot that goes unreported in domestic abuse cases. A lot of, I think the statistic from the American Psychiatry Association is around 75% of female survivors experience some form of injury related to domestic abuse. But then they can also have physical symptoms like headaches, insomnia, chronic pain, GI issues, chest pain, back pain, pelvic pain, all these physical symptoms that they go to different doctors for. And if the doctors aren't aware that domestic abuse is happening in the home, they can maybe sometimes treat the symptoms, but never really get to the root of the problem, which is probably the domestic abuse, right? And so what we do, we have a medical advocacy program at Laurel House, and a lot of other domestic violence agencies do as well, where we go out and train medical staff on how to screen patients for domestic abuse and how to refer them to services so that there's not a prolonged gap in care. You come in for an appointment, for whatever the issue is you're seeing a doctor for, and part of that appointment always includes a safe space to talk about what's going on in your life, in your personal life. And, if anything comes up that seems maybe unhealthy or concerning, the medical professional would be trained on how to say, hey, I have access to an advocate who can come and speak with you. Would you like to talk with them? I can help you make that call. And so we shorten the time that a person goes without being connected to services. And we can do that in healthcare facilities. They're kind of even set up in that way because of HIPAA and confidentiality requirements. It creates a safe space naturally. And
Right.
so in the domestic violence field, we're really pushing in the education piece, pushing medical professionals to be aware so that they can help make those referrals sooner rather than later. Because if not, we continue to see health problems. And I've had a lot of clients who have had stomach problems, even traumatic brain injuries from physical abuse that went unaddressed for years. And once they identified some of these other things that were happening for them with abuse, some of those symptoms got treatment or resolved.
Right. Because I'm thinking about my role as a primary care physician and whether this is something that tends to take a couple of times. You mentioned the continuity to develop that relationship and really, there have been times when I only had one interaction with someone and my spidey senses were already tingling,
Mm-hmm.
but they might not have been ready
Mm-hmm.
to have that type of disclosure or make that type of disclosure to me. Is that typical, or are there people who they're waiting to be asked even if they just met you?
Yeah, I think it depends on the person. So I think the answer is yes. There are absolutely people who are waiting to be asked and to be able to share. And then there are definitely people who need a little bit more time to build that connection and feel safe to be able to, offer a little bit more information and be vulnerable in that space to share with you or their, medical professional what's happening. Either way, one of the things that you can do or any medical professional can do is always have literature available sitting out. You can have tear off posters or the QR codes to scan in your bathroom stalls. So that's a private place someone can take a picture to get information to connect to your local domestic violence agency. As providing that safe, confidential space to speak with somebody. There's a program in California. It's called Futures Without Violence, and they created this really neat, it's like a trifold card, and they have updated versions of them now. I used to do the medical advocacy program 6 or 7 years ago, so I'm sure the ones they have now are updated. But there are these really cool little cards that they would hand out. They were encouraging medical professionals to hand out to every patient they saw with the standard, we give this to everyone we see. It may or may not apply to you, or it might apply to a friend or family member, so we make sure everybody has it. And then they give the person an opportunity to review it and ask if they have any questions, and then they know this is a safe space. They also can talk with them about, if you can't take this home because it's not safe, you can leave it here. And anytime you want to come back, here are the hours that we're open. And you can always use our phone.
Right.
So really creating that safe, open environment is important.
That's a great point. Do you recall, Ms. Bookman, did anyone ask you, did you have any medical visits or mental health visits, and were you screened for domestic violence? You're on mute, just so you.
Thank you. Um, so I was raped by my ex, and as a result, I got pregnant. And it was it was a weird pregnancy. My first two kids, I was over the moon excited. But for this one, I looked at it as, now I'm trapped.
Hmm.
I don't, I didn't know at the time what the sex of the child was, but I just felt this is going to be a boy. And if it's a boy, he's not going to let me go because he's going to want his son, or he's going to take my son from me. And I would go to the doctor, but the doctor never asked me anything. It was really hard. Unfortunately, I did lose that pregnancy. Um, and when it happened, I was angry a lot. I was angry a lot. And I couldn't understand why I was 7 months pregnant when it happened. Now I realize things happen for a reason, right? But during that time, the doctor never asked me anything, but maybe because I put up such a brave front, because again, that mantra, what happens in our house stays in our house. And I was being strong, protecting what was going on. And I never saw myself as a victim. I didn't even see that as rape, although it was done at knife point. I mean, I don't know. I don't know. And I know to some listening, it may sound as if, you're stupid, or when you're in it, you just don't realize it. I, I see it now, and I'm so grateful that I'm alive to be able to talk to people and about it and share my story. It's so important to share the story because you're right. You never know who's listening. And even if it's one person that you reach and they feel, you know what, Debbie Bookman did it, so I can do it. Um, yeah, I right now in my role as prothonotary, I tell people it's not just about a filing when you come in to file these things. It's an experience. And Dr. Shabazz, you said it, you get your spidey sense as a doctor.
Mhm.
It depends. Every now and again, I'll go out and I'll work the front counter and I'll get a vibe. And I will just engage with that person. And I have some business cards that has my personal cell phone number on it. And I'll give it to that person. And over the 4 years that I've been in this role, I've received 2 calls and 2 text messages from 2 individuals that I gave it to. Um, I just let them know that this is a safe space. This is somewhere that, even though it's a court office, you can come and you can sit in my office by yourself or with me. Um, I'm grateful to be in the
And
role that I'm in.
I commend you for the willingness to share your experience because even seeing how much emotion this many years later, and I might consider you an expert on this topic at this point, where still it is striking an emotional chord. What you experienced this many years later, which really further amplifies just how impactful domestic violence can be, where it can, really cascade into multiple areas of your life, your other relationships. And, many physicians would venture to say that likely played a role, in your pregnancy outcome, which is a terrible one. But, all of those stress hormones and whether or not there, was a specific trauma, physical trauma that you endured, the emotional trauma, it has a physical effect. So I thank you for even despite that, obviously still raw emotion, that you're able to come and share your experiences so that someone may benefit and take action. So again, thank you for that. Just to remind the audience listening, you're listening to the Her Health Matters radio show. I'm Dr. Sophia Shabazz, and we're live on WURD radio at 900 AM, 96.1 FM. Join the discussion by calling 215-634-8065 or toll free 866-361-0900. You could save a life just by sharing your experience. So we look forward to hearing from you. Um, and I read this because you touched on this, Ms. Bookman, and when I was reading the definition of domestic violence earlier in the show, there's another element that is part of what you mentioned, this reproductive coercion, where you mentioned how you felt trapped. And reproductive coercion can include, um, reproductive health decisions that could, be explicit attempts to impregnate someone, to trap them, or coerce them to have unprotected intercourse, or interfere with contraception, or, oh, the condom broke, or, um, what do you covertly remove it, and things like that. Can either of you speak more on this topic? How common is it? And are there specific ways that people can protect themselves against this form of abuse?
I could I could go, Miss Bookman, if that's okay. Great. So reproductive coercion is something that does come up pretty frequently, and we usually see that in the manipulation of contraceptive use. So not allowing people to take birth control pills, going along to gynecological appointments and trying to be in those appointments or OB appointments if there is a possible pregnancy, poking holes in condoms in particular. So either hiding the birth control pills or poking holes in all the condoms so that they all just keep breaking in an attempt to impregnate a partner against the partner's wishes, or coercing or in some way pressuring someone to become pregnant. And then at that point, I don't think I would call it interesting. It's additionally distressing that then once a person is pregnant, they become even higher at risk for physical violence to happen. So the pregnancy then brings in an additional layer to an already unhealthy and abusive relationship and creates an additional piece that an abusive person can try to manipulate and control. And so there's this control at the beginning to manipulate the autonomy of their own reproductive health, and then also once a person becomes pregnant, manipulate and control the actual pregnancy. And that could include anything from pushing someone down the stairs or kicking them in their stomach, which I've seen, threatening to cut a baby out of their stomach, which I've also seen people receive that threat. Any of those things I think sort of fall under that same umbrella. And it really is a very vulnerable, personal, not that not all forms of domestic abuse aren't vulnerable and personal, because they are, but I feel like there's an additional layer when we're talking about reproductive rights and reproductive coercion.
It just seems particularly evil. I'm trying to find like a more clinical term, but it just seems particularly evil to create a situation that allows the pain you are able to inflict to be greater by adding this additional layer. Goodness. What would you say would be some legislative changes or initiatives that are necessary to reduce the impact of domestic violence? And what can we as a community do to support these efforts?
I think there are so many. Ms. Bookman shaking her head. Yeah, I know. So one in particular that is something that people could actually look up online is it's called Act 44, and it provides funding to domestic violence agencies. And right now, the PCADV, the Pennsylvania Coalition Against Domestic Violence, is pushing to they're advocating for a $4 million increase to the Act 44 funding for domestic violence survivors in our state budget in Pennsylvania. And you can go to their website to check out and sign the petition, because there are a lot of answers, I think, to this question. It starts all the way down from birth through adulthood, and there's a lot of different things that I think as a society and community could be working on. But in general, lack of funding is definitely an issue to be able to provide the services and hope to then break the cycle of abuse so that the next generation isn't engaging in abusive relationships, they do something every year through PCADV. They reach out to all of the domestic violence agencies, and they have us track for one day out of the year how many people are receiving services in that day and how many needs went unmet because of lack of funding. And in 2022, there were in the state of Pennsylvania, 3,500 big survivors were served, but 400 service requests were unmet because we didn't have enough funding across the state at our agencies. So funding is really the biggest need in order to keep these programs going and expand them so that we can really do what our mission says, which is to end domestic violence for every person in our community. And I wish there's other ways to do that, but money is one of the
and money is the most impactful, programs. Ms. Bookman, what would do you have, a particular intervention or legislative intervention that you're particularly passionate about? I know it's multidimensional, as Ashley mentioned, but what would you want to lift up?
I would like to see an expansion made to the protection from abuse order laws. What people really needs to understand is that you don't get to that physical part overnight. They don't just wake up and hit you. Or it's a buildup. And I feel that I see many people come in to get protection from abuse orders, and he yells at me, something that they will feel like, well, that's not really violence. But that's the prelude to the violence. And I really, whether it's through social media, whether it's through technology, through phones, they have to realize that this could be the beginning of the end. And that's where the legislation needs to come in place, because when they go to the attorneys, in front of the judge, and I've spoken with many judges, and I say to them, like, I don't understand how that was denied. What are you waiting for them to end up dead? And I know that probably they look at me like, okay, that's a bit extreme, but you know what? Everything for me is extreme because I know how bad it can get. And what they would say to me is that we have to rule within the law. This is what the law says we have to do. And I understand it and I respect it. So how about we change the law? So my thing is, what can we do? We can call our legislators. We can go to Washington or to Harrisburg when these laws are being voted on to move it through and it's a process, right? But we need to be there to be able to share our stories. This broadcast, maybe a legislator will see it and they'll realize, not that they don't know, they know, but it's really hard. And I think about it all the time, ending domestic violence. I don't see an end in sight. And I don't want to be a Debbie Downer, but the problem is when I started speaking in the beginning, it started when I was little. And when you're taught that or you're programmed into hearing that, you believe it. And then as an adult, that's what you receive.
Right.
So will it ever end? I don't know.
Right.
But can we get better with catching it earlier to save lives?
Some type of intervention. Many couples, maybe most, argue or have conflict, but that if one person feels threatened, that there is some type of avenue to take or intervention before things escalate. So thank you for that. And thank you for coming and joining the Her Health Matters radio program today and sharing your story for the work that you do every day. Ashley Thompson, thank you for coming and sharing more about what you do and Laurel House, and for being in the trenches from day to day. As I started off the show, it's a worldwide problem. And we can only be wherever we are. So thank you both for providing that valuable insight. Can you, Ms. Bookman, let our audience know how someone might reach out to you if they would, um, I don't know if you would like for people to, or do you have any parting words?
I would like to thank Her Health Matters for inviting me. I think it's really important that people realize that there are people in all walks of life that have been through a lot. Um, Trauma doesn't have a face and a type. I can be reached at the courthouse in Westchester, 201 Market Street. My phone number, my direct line is 610-344-6052. I'm available, again, even if it's just someone to sit and listen. Sometimes people just want to be listened to. But it's important for me that I do this because that's my healing. That's
Right.
how I get stronger every day.
Thank
So I thank you for the opportunity. In Laurel House, I do a lot of things with the Montgomery Prothonotary and with the Domestic Violence Center out there. So I thank you for all that you do. It is so important. And the funding needs to keep coming, and we have to keep fighting every day. So thank you. Thank you, Dr. Shabazz.
Thank you. And quickly, how can someone reach Laurel House?
Sure. You can call our 24/7 hotline. It's 1-800-642-3150. You can also reach me at the office at 610-277-1860, extension 119, or you can just Google us. It'll come up on the internet. And you can access us that way and send us Facebook messages. However you want to reach us, we will respond as soon as we can.
Thank you so much. Well, we are going to move right into our policy and women segment. It's a great segue where we talk about important policy initiatives, and we have to stay aware, educated, engaged regarding policy and legislation that impact a woman's health and wellness. So first, I want to remind everyone that the general election is in just a few weeks on November 7th. Go to votes.pa.gov to make sure you're registered to vote, and also double check your poll location because sometimes polling locations can change. If you are not registered to vote, please register by the deadline, which is tomorrow, October 23rd. There's still time to get a paid position as a poll worker for the upcoming election. Check out your respective county to find out about upcoming training dates. Earlier this month, State Representative Latasha D. Mays of Allegheny County launched the Pennsylvania Black Maternal Health Caucus, along with the support of caucus co-chairs Gina Curry, Democrat of Delaware, and Morgan Cephas, Democrat of Philadelphia, in an effort to find legislative solutions to Pennsylvania's high rates of Black maternal mortality and morbidity. One of the key areas of focus of their work will be proper data collection. Accurate tracking is vital for the research and understanding of what measures need to be put in place to improve maternal care and decrease the disproportionate number of Black babies and mothers dying. According to Pennsylvania House's website, Black women and birthing people in Pennsylvania are 2 times more likely to die before, during, and after, up to a year after childbirth compared to their white counterparts. Black maternal mortality is a public health crisis, and we must take bold action as legislators and as a state government to make investments in Black maternal health. These are the words of Representative Mays. In the 2023-24 state budget, Governor Shapiro allocated $2.3 million specifically for Black maternal health, demonstrating our Commonwealth's commitment to this critical issue. So these are important things to be aware of as we move into the Making Moves segment, where we share information about health and wellness events in our area. The Pennsylvania Human Relations Commission will hold a sexual harassment symposium from 8 a.m. to 3 p.m. on Thursday, November 2nd at the DoubleTree by Hilton Hotel in Philadelphia at 237 Broad Street. This free one-day in-person conference will bring together practitioners, investigators, attorneys, policymakers, activists, and advocates invested in ending sexual harassment in all spaces. The theme of this year's event is finding power in your voice. Through engaging discussions, interactive workshops, and inspiring panelists, we'll explore ways to find strength in our voices and create positive change. The easiest way to find the registration link is to visit PHRC's Facebook page or Community Hero PA's Facebook page and click on the post. In response to the continued gun violence in some of our most challenged neighborhoods, residents have pulled together a boots on the ground program called Hug the Block. It's designed to put peace patrols on the streets between 10 p.m. and 4 a.m. to show solidarity and help curtail the violence. This initiative is spearheaded by Philly Truce in coordination with the Philadelphia Police Department. Community Hero is looking to support this initiative next Saturday, October 28th. If you want to be a volunteer for a 1-hour shift or more in the 5800 block of Germantown Avenue, which is Germantown and Worcester, please visit at Community Hero PA on our Facebook page or even Instagram to sign up. Training, safety vests, and flashlights will be provided before the shift starts. So as we wind down today's episode, I want to urge anyone in our listening audience who may be in an abusive relationship and needs help to contact a local organization, whether that's Laurel House if you're in Montgomery County or organizations in your community. You can always contact the National Domestic Violence Hotline at 800-799-7233, or you can text START to 88788. You can also visit the website, which is thehotline.org. The producer of this show is Community Hero Action Group, a 501c3 nonprofit that is on a mission to create equitable health and wealth outcomes in the Black community. Join Community Hero as a volunteer for a wide range of programming, such as this radio show. Visit the website at communityheropa.org or email us at contactus@communityheropa.org. It takes all of us to get this work done. I'd like to thank the executive producer of Her Health Matters, Nicole Keels-McGruder, the founder and chief operating officer of Community Hero Action Group. And of course, thanks to Word's technical producer, Miss Rhonda Gibson. Thank you for joining me today. Remember that everyone deserves to be in a relationship without abuse. Your life matters. Please join us next month on the fourth Sunday at 2 p.m. for another episode of Her Health Matters. I'm your host, Dr. Sophia Shabazz, wishing you all the happiness and wellness you deserve. Until then, be healthy, be you, because you're healthy.
Our focus is our health, mentally, physically.